Howdy, howdy, howdy. I'm creating this video because I've had a few people ask me, why do you need a liver transplant? And before having cancer, I probably wouldn't have understood that either. I thought it would be good for me to kind of give a little bit of an overview of stage 4 colorectal cancer and why, for me, a liver transplant could be curative. In my case, cancer originated in the colon, which is why I have stage 4 colon cancer, but it is primarily present in my liver. At the time of diagnosis, I had 14 tumors spread throughout my liver, and they were at that time not resectable or treatable with targeted treatment, meaning they couldn't go in and cut them out. They couldn't go in, radiate them because there was too many of them. And so I did chemotherapy. I had a emergency surgery to remove the tumor that was blocking my colon. So my colon has been clear since that surgery, but my liver has not. The chemotherapy that I initially had was very effective at shrinking the tumors in my liver. 2 of them disappeared on chemo and all the rest of them shrank. So then I qualified for what was called liver resection and ablation. So they were able to go in and resect or cut out, like scoop out one of my tumors, and then the other 12 or 11 they were able to burn with microwave ablation. Because my liver was so diseased at diagnosis and there was cancer throughout, the surgeons were confident that there was microscopic disease in my liver that they just couldn't see. So I continued with chemotherapy until I received what we call like a negative DNA test. It's a circulating tumor DNA test. And so what it measures is the amount of tumor DNA from my original tumor present in my blood. And when it was negative, we stopped chemotherapy and I was able to be off treatment for about 8 months until cancer showed back up again. And you guessed it, in the liver. We think that it was probably one of those 2 that had disappeared on chemotherapy had grown. So I had another liver ablation last February, and then just 1 month after that microwave ablation, I had 2 more tumors pop up. And so at that point, my liver surgeon recommended, because I did not have disease anywhere else in my body, only the liver, he recommended that I start to pursue liver transplant. So in the case of colorectal cancer, when it is stage 4, meaning it moves outside of the colon and it goes to the lymph nodes or to other organs, the disease is not curative. Our palliative options, the 3 primary ways that colon cancer that has metastasized are treated is chemically, like chemotherapy or immunotherapy. A lot of clinical trials out there involving that method. Resection, you can cut it out, so you can resect lungs, you can resect liver, you can resect a lot of your organs. You can also have a surgery where they can treat abdominal mets that requires liquid chemotherapy in the abdomen cavity. It's very interesting. It's called HIPAC if you want to look into it. And then lastly, like radiotherapy, so like radiation, that can be external beam, it can be via radioactive seeds, there's other ways as well. Currently, I am considered a stable stage 4 colorectal cancer patient with unresectable disease, meaning they've tried to resect it in the past out of my liver, they've tried to burn it, and at this point, they feel like it's just going to continue to keep coming back. And so the only opportunity for a cure for me is to start fresh with a new liver. The beautiful thing about a liver transplant is that you can have either a deceased donor liver or a living donor liver. And a living donor can donate up to 70% of their liver to me. My entire liver would be removed. I would get the portion of their liver transplanted. The liver regenerates, and it does it very quickly. So the donor liver can regenerate to around 100% or to an optimal size within like 8 weeks post-surgery. So it's pretty phenomenal. And so me qualifying to be listed as a liver transplant recipient is huge. You know, I know that God doesn't work in statistics, and he can do whatever he wants. He can choose to heal me today if he wants to, and he could choose to not heal me through this liver transplant. But statistically speaking, survival rates, like long-term survival rates for individuals with colon cancer that has metastasized to other organs, the 5-year survival rate is 10%. Very dismal. Very depressing. But for a liver transplant colorectal patient, it's upwards of 70 to 80% 5-year survival rate. And I think it's like 65% of those individuals don't have a recurrence of cancer. So the next question is, can cancer come back after I've had a liver transplant? Yes, it can. We pray that it doesn't. That's why we've been doing so much chemotherapy, to make sure that there is no microscopic cancer left in my body when we do this transplant, to reduce any chance of recurrence. But it is possible that it could come back. Very rare that it comes back in the liver, but it is possible. I could have another liver transplant. I can also have treatment on my liver, but often it comes back in other places, particularly the lungs. So we are praying for no recurrence. If you stuck around this long, I'm going to be doing some future videos on how liver transplant works with a living donor, some more information about what is my recovery going to look like, how long is it going to take me to get back to my normal self, which, let's be honest, no one is ever going to go back to who they were after this happened to them, and some other videos. So just trying to keep this content updated for you all. I have no desire whatsoever to be any type of influencer, but I do believe that God has given me a beautiful story of suffering and shown his faithfulness through that to me. And my goal has always been to testify of his goodness through this journey. And so I just feel very strongly that he wants me to continue to share on these platforms, and so that's what I'm going to do. I hope that you'll follow along and you'll be encouraged. I hope that you'll invite others to follow along as well, and that you give God all of the glory for all of it.